Thank you very much for a wonderful invitation to be sharing my thoughts with you today. And my topic is patient expectations and ChatGPT and beyond. I thank the organizers for giving me this opportunity, and I'm sharing some photographs of our family's visit to Russia and Petersburg, and we had a wonderful time out there. So it's really nice to have such fond memories. These are screenshots from a video that was circulating on WhatsApp from Italy. A patient died, and the doctors and the hospital staff had to barricade themselves inside a room to prevent them from being assaulted. So, this is an unfortunate state of affairs where violence against doctors is happening all over the world. Now, what is the reason for this? For that, I think we should understand what are the patient's expectations. Now, this is a photograph that I have taken at the airport, and you can see that there are a large number of wheelchairs at the airport. What does that mean? It means that the person's mobility is compromised. They cannot even walk up to the aircraft. However, they want to go around and see the world. So, as age advances, comorbidities are there, but the expectations are unrealistic at times. On the left hand side, you see my family. We are fortunate that four generations are alive together. My grandson is 4 years old and my father is 94 years old. So there's a 90-year gap between the two. And why I'm showing you is that this is going to be commoner because life expectancy is increasing. So on the right hand side, you see a elderly lady of 111 years who has been operated for her cancer by a surgeon who is also elderly, is 68 years old. And that is why both Time Magazine and National Geographic has indicated that our life expectancy is going to exceed 120 years. Now, with that background and the expectations, let us look at certain diseases. So, this is an example of lung cancer. Initially, on the left hand side, you see that we would call them all patients as non small cell lung cancer. Then we were able to divide them into three groups: adenocarcinomas, squamous cell carcinoma, and others. And now, based on molecular changes and driver mutations, we are able to divide them into 30 different types. And based on these 30 different types, we are also treating them different. But if you look at the survival, irrespective of how we are treating them, whether it's chemotherapy or immunotherapy or targeted therapy or combination, the survival has remained unchanged more or less over the years. What that means is that if we can't distinguish or improve the survival, then at least we should take into consideration what patient expects out of treatment. And this is an example of a similar finding for esophageal cancer. And this is on breast cancer. So there are two similar drugs, two similar efficacies, but the side effects are different. So with ribociclib, you can see that neutropenia and hepatotoxicity is more. And with abemaciclib, there is more diarrhea and thrombocytopenia. So some side effects that we want to avoid should be important way of deciding how to treat the patient. Now let us take the example of two people. One is a lawyer who is dependent on speaking in court, and the other is a model who is walking the ramp, and her appearance must be appropriate so that she can continue her profession. In these instances, how we treat the patient has to take into consideration what is their profession and what is their expectation. Treatment and patient expectations is not a new subject. A few months ago, I did a literature search, and you can see that 190,000 hits on patients' expectations from cancer. And this is well studied as well. Systematic literature searches showed 46 studies involving more than 10,465 patients, and various outcomes were reported. This is a more recent prospective study that was done in the Scandinavian countries called the EXPECT study. Now, what is the important thing? This is another study of rotator cuff repair surgery. The doctors, what they feel is shown on the right hand side, and it shows that 72% of doctors are focusing on pain relief. But if you look at what the patient wants, it's pain relief is only number two. The most important thing for the patient is increase in the range of motion of their shoulder. Now, if we don't understand that, obviously patients are going to be disappointed. We decided to do a study to look at the other side of the table. In other words, this is a WhatsApp group of doctors, oncologists, cancer specialists whose near relative had suffered from cancer. And we decided to ask them what is it that they expect out of the treatment from their relatives. And this was the priority that they had to make in the six options that they had: best chance of cure, longest possible survival, least side effects, least visits to the hospital, least out of pocket expenses, or entry into a clinical trial. Now, obviously, as oncologists, we would have expected that everybody selected either best chance of cure or longest possible survival. But that was not the case. True, majority did select that, but there was significant number of doctors who selected least side effects or minimal visits to the hospitals as their first priority while treating their close relatives. We did another study, which was a match pair analysis between patients and their caregivers. And you can see that there are 122 pairs. We divided them into those where the caregiver was living in the same house and not living in the same house. And we further subdivided them into those caregivers who were bearing the cost of the treatment of the patient and who were not bearing the cost. Lo and behold, the choice between what patient wanted and the caregiver wanted was same in only slightly more than half the patients. In 44%, the outcome, the first priority was different between the patient and the caregiver. And therefore, this conflict needs to be resolved as well. Now, when we want to do this and we want to do an efficient job, we should use the tools that are available to us, like, for instance, ChatGPT. And we have written several articles on ChatGPT that were published in the Indian Journal of Medical Sciences, the CRST Journal, and also the Indian Journal of Medical and Pediatric Oncology. But when you look at ChatGPT, our experience is that it is wrong in almost half the times when suggesting a novel research idea. It is wrong in 45% of times when generating data which is often incorrect. And in 20% of the times, it is hallucinating. That means it is giving information as if it is true, but it is fake, and it's very difficult to find this. So we need to move beyond ChatGPT. Now, these are images that were generated by prompt. The prompt was create an image of a serene mountain cabin surrounded by pine trees with mist rolling in. ChatGPT is on the right hand side and Gemini is on the left hand side. And they are all fairly reasonable. And this was a photograph that I took from the students who were attending a conference where I was a speaker. And I find that several of the students were using digital devices to make notes. So I took them aside and I asked them, what is it that you do after taking the digital notes? And it's very interesting how students have been innovative in using the technology. So they make the notes, then they compare that to the textbook or the PDF, and then make flashcards, which they use to revise during the examination. And they also share it both at the institution level or the national level so that their job becomes easier. So let us look at some of the tools that can help you beyond ChatGPT. So one is Umata. And what does this do? It is able to read a PDF in such a way that you can query it, interrogate it, and ask questions. So in this particular instance, the PDF is on the right hand side, and I was asking questions about the toxicity and the efficacy. So the efficacy is shown here. And in the PDF, it highlights the yellow part where the data is also there. And so also for the toxicity, it was doing that. Now let us look at consensus. I've read a PDF, I've looked at the information available, and I think that I want to do some research. Then first I should do literature research to see whether it is worth doing some additional activities in that subject or not. So consensus helps you. So the first thing that I did was ask them, is it possible to cure childhood cancer? And you can see that there is 100% consensus. What this means is that I do not have to prove this, it is already proven. The next I took is, can we reverse muscle wasting or sarcopenia in frail elderly? And it says that it is possible, that is neither here nor there, in two-thirds of instances. So it means that a lot of people have made an effort to do some studies here, but no concrete results have come out. And then the third question that I asked was, does cancer screening improve all cause mortality? And here it is very interesting that it's 40% are saying yes, 40% is no. And that means that there is a very good chance that if I do some research in this, it will be useful and then it can get published in a good international journal. So this is how consensus can help. Then we move on to sci space or science space. And the idea of doing that is you ask a question. Here, what I've asked it is what is the difference in cancer specific and all cause mortality? And then it gives bullet points as well as definitions. And below that, you will see that it is giving publications and what is the insight that is obtained from the publication. On the right hand side, you can see the column which shows additional columns that can be added to this based on what exact information you require from this or not. And then you can continue to do that. And finally, if there is a full text which is not available to you, then this tool can actually help you communicate with the corresponding author. And hopefully, he will send you the full text article, which you may otherwise not have access to. Now let's look at Pop AI. Here it helps in two ways. One is AI generated PowerPoint presentations, and the other is AI generated medical writing. So for the PowerPoint presentation, I use the title Use of AI Tools to Improve Patient Understanding of Cancer Management. And lo and behold, it gave titles and subtitles so that the PowerPoint presentation can be generated. And in a few seconds, the PowerPoint presentation was ready. It is also possible to tweak this presentation. So you can see that in this particular instance, the visual was not appropriate for successful AI in implementation. And then I asked it to generate some images by artificial intelligence, picked up the image that I was interested in, and replaced that in the PowerPoint presentation. So this way, instead of spending half an hour or 1 hour, you can have PowerPoint presentations ready in a matter of 2 to 5 minutes. Now, if you find that the AI generator is not able to create a visual that you want, you can actually use a prompt that can specify what is expected. So in this, I have used 320 words prompt to ask the artificial intelligence to generate a proper visual. And this is how it generated the visual. Then I asked it to make it a person with brown skin. So that changed. Then I asked the person to be elderly. And then I changed the environment to say that it's a busy hospital and there are other people around while the discussion is happening. And finally, I said, imagine that a Russian nurse is explaining to a stout old lady with the help of a chart held in her hand. And that is the image that it was created. Everything is done by artificial intelligence. The other thing I mentioned is artificial intelligent manuscript writing. And here I said, what is the judicious use of AI tools to facilitate studying by medical students? And here you can see that it starts with point one and goes all the way to 6.2 to bring out the entire summary of a manuscript that will talk about judicious use out of artificial intelligence. Now you have done all that, you have made a presentation, and now you want to make a video. So you have the TurboScribe, which is unlimited audio and video transcription. You can see that here I made a video in which I'm talking in English, which is the original English video. And then I want to translate it into Russian. So you can see that this TurboScript allows me to have Russian captions as well as a Russian transcription of what I want. And then we have Vozo AI and Veed AI, which actually does the actual translation of the audio as well. I have no idea what I spoke in this, but this is the translation along with the caption that was given. So, to take home message, patient expectations are often different from what we imagine. If we take these into consideration while treating the patients, they will be more satisfied. AI tools beyond ChatGPT make our tasks more efficient, and we have to work smart in addition to working hard. This can allow us to do a great job beyond language barriers. With that, I thank you very much for a patient hearing. And I hope that my presentation was useful to the audience. Spasiba.